Espino, welcome to our program. As this crisis drags on and people are locked down in their homes, is it your sense things are getting better or worse when it comes to misinformation?
Well, I think, unfortunately, they're not getting better. Especially in the U.S., we have elected officials such as President Trump not always agreeing with our experts. For example, on hydroxychloroquine, which President Trump was promoting, several trials have shown that it's likely not to be effective against curing COVID-19. Yet a couple tried to ingest a substance with it, and the husband died, and the woman is in a coma. So it's unclear at this point, you know, if the government doesn't actually support the public health messaging and trusted, reliable expert opinion, if it's going to get better. It's not clear if it would get better. Of course, the leaders here have a responsibility, but there's so much disinformation and falsehoods on social media, on various platforms as well. Mm-hmm. Yeah, and it's really hard to know how to combat that given the size of that problem. Public health officials are trying, but without a direct link to every household via their phone or something else, it's difficult to know how to do that. I applaud the social media platforms like Facebook that are trying to put out reliable information and link people to trusted sources. I think that's a great first step.
What are the dangers of rumors and falsehoods and misinformation in our current pandemic reality?
Yeah, well, like I said, it could lead to death in the case of the Arizona couple, not trusting correct information. But for the general public, I think it leads to a lack of compliance with the kinds of behaviors that we're asking them to do. So if people don't know what to believe, for example, if they think the virus is just a flu or that it can be cured with salt water, then they're unlikely to comply with staying at home and limiting the spread of the virus. So we really need to be clear and consistent about what we know and what we don't know. And we need that information to come from the top so that people are all getting the same messages and that they can trust those messages.
But if people are stuck at home and with not much to do, and they're constantly resorting to social media to get their information, how do you change that? How do you change that pattern? How do you change that way of thinking that the information we're getting is the truth?
Mm-hmm. Well, I think it could start by having more contact between public health officials and elected officials and the general public. For example, in Singapore, we know that individuals receive on their phones messages that contain important information about COVID-19, and they had set that up prior to this pandemic, which makes a lot of sense. If people get a trusted source every day, a message on their phone, they're likely to know that that's coming from a trusted source, a public health official, and to comply with that. That's the kind of thing I would like to see happen in the U.S. in order for people to know where to get reliable information from.
That's a really good point. I'm sorry I interrupted you. Go ahead.
Oh, that's okay. I think also public health elected officials could take questions from the general public about what is known and what is unknown, and to tell them when we're going to have answers to those questions. So, for example, there are several treatment trials underway. When are we going to know the results of those trials, and how is the government working to respond to those? And let us know. That way we know that these things are underway and when to expect those results.